Okay, good afternoon, ladies and gentlemen. Welcome to our webinar. Okay, our webinar will start soon. Okay, so welcome to International Webinar on Smart Healthcare Science and Technology. Today's health webinar is held once a month, and today our topic will be focused on the digital dentistry. So I'm Minh Ye. I'm current chairman of biomedical engineering department at NCKU. I'll be the moderator today. Okay, so at the first, may I request all of you first turn off your microphone during the conference. So later when we have a Q&A section, maybe you can turn on your microphone if you need to ask a question in person. Okay. So today we have a very strong, distinguished guest to be our guest opening remark. So first, I will invite Dr. Hoang. Dr. Xu is current director from Science and Technology Division Taipei and ECHO in Vietnam. So let's welcome Dr. Xu.
Okay, thank you, Professor Ye. Professor Sirichai, Dean of Faculty of Dentistry, Mahidol University. Professor Trong, Director of School of Dentistry, National Cheng University. Professor Ye, Chairman of Department of Biomedical Engineering, National Cheng University. Distinguished speakers and guests, ladies and gentlemen, good afternoon. I am honored to join today's webinar organized by Taiwan Center for Smart Healthcare Science and Technology in Thailand. The center was established by National Cheng University and Mahidol University and is sponsored by Ministry of Science and Technology Taiwan. One of the missions of Taiwan Center for Smart Healthcare Science and Technology in Thailand is to promote a medical innovation ecosystem for bilateral and multilateral partnership. I think this webinar series, which was initiated last September, provides an excellent platform for connecting scholars in Taiwan and Southeast Asia countries to share innovative ideas and research results, especially during the COVID-19 pandemic. The theme of today's webinar is digital dentistry. This is certainly not a new topic. Nevertheless, with the advances of digital technology, especially artificial intelligence, there will be more innovative researches for this interdisciplinary collaboration. The organizing team told me that there would be more than 100 young researchers and students from Taiwan and Southeast Asia countries participating in this webinar. I do hope that the audience will be inspired by today's speeches and pursue more further researches in this area. Today we have speakers from Bangkok, Ho Chi Minh City, and Tainan. I myself am now based in Hanoi, Vietnam. As the Science and Technology official sent by Ministry of Science and Technology Taiwan to this region, I am glad to see the progress of the medical innovation ecosystem proposed by Taiwan Center for Smart Healthcare, Science and Technology in Thailand. I believe that with the effort of both National Cheng University and Mahidol University, we will be able to see fruitful results in the near future. Finally, best wishes to the success of today's webinar. We are all experiencing the hardship of the COVID-19 pandemic. Please stay safe and healthy. Thank you. Okay, Professor.
Thank you, Dr. Xu. Thank you. And next, we will move on next guest honor will give us open remark. Next speaker is Dr. Sirichai Kartovannocharan. Sorry if mispronounced your name. Dr. Sirichai is current associate professor and also dean of faculty of dentistry, and also in the Department of Oral and Maxillary Surgery, Mahidol University, Thailand. He's also long-term good friend of NCKU. Let's welcome Dr. Sirichai.
Okay, thank you very much. 谢谢你. Good afternoon. And Professor Liu Hoang, Counselor and Director, Science and Technology Division, Taipei Economic and Cultural Office in Vietnam. Mr. Thongchai Chasawat, Executive Director, Thailand Trade and Economic Office. Professor Minh Longyue, Chairman of Department of Biomedical Engineering, National Cheng Kung University, Taiwan. Associate Professor Dr. Rudy Sulalit, and all distinguished participants. 大家好. On behalf of Mahidol University Faculty of Dentistry, I am honored to be invited to deliver my welcome remarks for the 2021 International Webinar Series on Smart Healthcare Science and Technology, hosted and organized by NCKU with the theme Digital Dentistry. NCKU and Mahidol University have built a great partnership through collaborative activities since the past couple of years, most notably the establishment of the MU-NCKU Joint Research Center. We are very delighted to have such ongoing relationship with NCKU and hope to continue this close collaboration and partnership for years to come. As we all know, the digital revolution is changing the world, and the digital dentistry is definitely a part of that. What used to be manual tasks are being replaced by computer-aided digital devices, making dental procedures easier, thus producing precision outputs through computer-generated designs. We are having the webinar to highlight the remarkable advance that we now experience in digital dentistry, which directly impacts the oral health of our nations. This webinar, I believe, will also provide a forum for international collaboration in ensuring that opportunities and challenges in digital dentistry in Taiwan and Southern and Southeast Asia will focus not only on a new vision and direction in digital dentistry, but also on improving the quality of dental research and education in the region. In this regard, I would also like to take this opportunity to extend my heartfelt appreciation and gratitude to the Medical Device Innovation Center and the Department of Biomedical Engineering of NCKU, as well as the organizing committee for their valuable support and contribution. Without them, the program today would not take place. Lastly, I would like to thank you all for joining us here today. Your participation is very much appreciated, and I wish everyone a fruitful outcome of this webinar. 谢谢你。
Thank you, Dr. Shirichai Wong, opening remark. Thank you. Next, move to our next guest of honor from our own, Dr. Trong Shufen. She is current professor and also the director and chairman of School of Dentistry at the National Cheng Kung University. Let's welcome Dr. Trong.
Okay. Chair and Professor Nong Ye, Department of Bioengineering, Director Huang Xu, Science and Technology Division, Taipei Economy and Culture Office in Vietnam, Dean Siri, and my friend Professor Rudy, Faculty of Dentistry, Mahidol University. Thank you for your address. And our distinguished speakers, Professor Fang, Professor Nakaparksin, and Vice Dean, and Professor Hoang from Faculty of Dentistry, Ho Chi Minh City University, and our local speakers, Professor Ching, all the local international guests of Evan. On behalf of School of Dentistry, KU, I would like to welcome all of you to join. I am grateful that you take your valuable time to join this webinar and your support to NCKU and our international partners, even though we are still handling the tough challenge of COVID-19 pandemic right now. Digital dentistry, including the of computer-based instrument, artificial intelligence, and the simulation technology have been widely applied in many fields in clinical dentistry and the dental education. Many fields, including oral surgeon, oral diagnosis, prosthodontics, and orthodontics. Digital dentistry can help in the field of diagnosis, decision making, and through this success, not only the efficiency has been enhanced, but also the improvement of accuracy and the quality are the most favored. The of digital integration has also been immersed in dental education. We can cultivate our next generation of dental talents through by using of the AR, the VR technology. The student can be trained in the field of their skills, and they can be inspired and broaden their imaginations. Moreover, the establishment of e-learning platform can broaden and remove the uncertainty and the locations and accelerate the growth of international academic collaboration. In this webinar, I would like to invite you to meet the latest innovation of Taiwan dental industries. The quality and the accuracy of these instruments, I think, will benefit your dental practice. NCKU would like to play the role to build the bridge to connect with the Southeast Asia University to know each other and connect and promote the international academia industry cooperation. Finally, I would like to appreciate MDIC and CKU in preparing this webinar and expanding our knowledge and the cognition in smart health. I wish this conference a great success, and everybody in this conference stay healthy and happy. Hello.
Professor Trong, Dr. Trong. Okay, so thank you. Okay, I would like to thank you, Dr. Hoang, Director of Science Technology, TACO in mainland, and also Dr. Xu Kai from the Mahidol University, and also Professor and the Chair, Professor Zhuang from NCKU School of Dentistry. Let me first thank you for your own warm remark. Okay, ladies and gentlemen, though I'm Minh, on behalf of the Department of Biomedical Engineering NCKU, I would like to welcome all of you to the 2021 International Webinar Series on Smart Healthcare Science and Technology, and today's future will be on digital dentistry. So at all this difficult epidemic time in Taiwan, and since the outbreak of COVID-19 last year, hope all our friends are safe and healthy. So we have all come to the way to this conference, and I am very grateful that all you can take a valuable time to join this webinar, include our distinguished guests, speaker, and the motivated scholar and the students. Thank you very much for your participation. Okay, so we all know dentistry is growing rapidly in digitalization, and is popular. Digital dentistry is also popular in Europe and the United States. And right now, this trend already continues to popularize around the world. So with the speeding or advance of the modern technology, so life is getting more and more convenient. Meanwhile, medicine has brought to a more accurate and widely used stage. So in the past, the dental industry also take advantage of this technology trend to suppress the limit and make the tremendous change in the process of surgical treatment. Also provide the patient with more accurate and safe procedure with more satisfactory outcome. So National Ching University has integrated domestic digital industry, government, academic, research institute into Taiwan's Medical Device Research and Development Center. So under the cooperation of field technology and the professional, NCKU has integrated research and development force into the driving force for development of energy for domestic medical equipment. So, by recruiting talent from the top foreign university and the top research institute around the world to Taiwan, and also encouraging graduate students to conduct research in the well-known and promising university, institution, and company with development potential, the research result will become more and more innovative and mature, and the less innovative and the entrepreneurial economy will be cultivated of a high-level talent with international mobility. Okay, so the next, I will introduce an important guest for this webinar. I will welcome our long-term friend from Thailand. She is current associate professor, Dr. Rudy Shuari. So she is in the Department of Oral Biology in Mahidol University. Okay, so we will invite Dr. Rudy, will be our distinguished representative to the Joint Research Center in the Mahidol University. She was also the former dean of dental school at Mahidol University before. So we believe that she will assist NCKU and also the Taiwan with her precious and professional experience. So we appreciate for her support and contribution. Let's welcome her to join us the future common target. Okay. Thank you. Welcome, Dr. Rudy. Okay, nice to see you again. Okay, so with the successful meeting and all of you is safe and healthy. Okay, so next we will take a group photo. So I would like invite all of our guest speaker to turn on your camera, and we will take group photo from our screenshot. Okay, we already took the photo from the other screen. Okay, thank you. Okay, let's welcome start our today's webinar. Let's first welcome our first speaker, our fresh Ph.D., Dr. Fang Ching. She's the current vice president of dental Codent Technology Industry Corporation Limited in Taiwan. So today her topic will be the dental handpiece. The technology continue to impact everyday practice. Let's welcome, we can say, Dr. Fang.
Yeah, okay, thank you. Hi, good afternoon, everyone. This is Ching Fang, and I am from Codent Technology Corporation, and I'm also a PhD from Ching University. Today, I'm talking about the dental handpieces. As you may know, that a lot of digital transformation in dental industry recently for the last decade, but not so many articles or researches to talk about the digital transformation for the equipment itself, like handpieces. So I'm going to talk about the handpieces. So I'm briefly introduce a little bit about myself. I'm now a vice president for Codent Tech Industry, which is our family-owned company. And I also founded two medtech companies. One is in China, one is in Taiwan. It's about medtech product sales channel company, and they are working well. And I studied my MBA in Johns Hopkins University in USA, and I just got my PhD, like Dr. Ye says, from Ching University, BME. Okay. So I'm talking about the handpieces history, and as I know, not all of you understand. Maybe many of you don't understand what is handpieces. So I'm going to briefly introduce the history about handpieces, and we will take an overview of the current technology about handpieces. And we are going to talk about digital trend of dental handpieces and the conclusion. And my speech is around 10 to 15 minutes. I'm going to take some questions from you as well. Okay. Can you see the PowerPoint now? I can't see. Okay. So from the handpieces, you may very surprised. We can talk about 9,000 years ago. So archaeologists found some evidence that says at that time people trying to drill tooths by something very sharp, like you can see on the photos. It's in Pakistan actually. So 9,000 years ago, around 7,000 BC, people started to try to make the operation of their tooths. And for the mechanical dental drill, it's not the drill tooth by the sharp things or stones. We use mechanical dental drills. It's from actually 1964. There is a doctor called George Harrington, who is from British. You can see on the photo that it's belt powered. So you can see the last photo, one assistant trying to use his foot to try to power the handpieces by belt, by foot and belt. So at that time, handpieces RPM running per hour, running per minute. Sorry, it's 3,000 RPM. So nowadays the handpiece RPM is around 400,000 RPM. So the speed is far away at first mechanical handpieces. And in 1957, it's around 60 years ago, there is a dentist from Washington, D.C., U.S. He founded handpieces we call air rotor, Borden. His name is Borden. So the handpiece named after him called Borden. And it's 1957. At that time, this is actually the handpiece is quite similar from nowadays. It's around 240,000 RPM. So Dr. Borden, actually we still have one handpiece is called Borden nowadays. So it's 1957, 60 years ago. But 60 years later, today, what we have for the handpieces, we will have a look. So as you can see on the photo, if you see the left side, 4 pieces, it's we call it electric handpieces. It's from restoration to implant technology. We can use the left 4 handpieces, and the right 2 handpieces, air-driven handpieces. So what kind of why we call it air-driven handpieces? As you can see, the air-driven handpieces, we have head here, and we have fur, we have neck, we have body, and if you see inside, we actually send the air through the coupler, go into the handpiece itself through the air tubes. You can see on the second photos. So the air actually blow into the head. There is an air turbine inside the head. So the air goes in to blow the air turbine to make the speed like 400,000 RPM, to make the power to drill the teeth. That's the reason we call it air-driven handpieces. Okay. For the electric handpieces, if you see outside, it's not big difference from air-driven handpieces. If you see inside, it's big difference. The electric handpieces, there is no air tube inside, only the gear. You can see the gear in the middle, and in the head, it's total around 7 gears inside. So we powered by electric motor. So it's not powered by air. It's powered by a motor. It's actually electric motor, and we call it micro motor. So the micro motor sends the power into the handpieces to make the gear rotating, and there is a gearbox in the body. So the speed will be speed up or slow down, and to transfer the different speed to the head, so the bird can drill or can do the implants. That's the scenario of the electric handpieces. So the year from 1957, we say the Borden handpieces. But 60 years ago, we have new products called digital or electric handpieces. Why people like electric handpieces? If you can see on my PowerPoint, there is a unit here. That's from one of our customers. It's a very famous brand called Castellini. Castellini is a very famous brand in dentistry. I think they are from Italy. And if you see these parts, so this chair is their products export to Asia. So if we enlarge them, you can see there is one electric handpieces and two air-driven handpieces. That means the electric before was all air-driven handpieces, but nowadays they try to export the units with one electric handpieces. That's we see the trend. And why people like electric handpieces? As you may know that if you are a patient, you go to dental clinic, you are really afraid of the high noise and high vibration of the handpieces. And same as doctors, dentists really don't like the high-speed air-driven handpieces with a lot of vibration and noises. As you can see, the air-driven handpieces, they can have the power around 18 to 35 watts. Electric handpieces is much powerful. It can generate 50 to 60 watts. So why we need higher torque of handpieces nowadays? Because now for the last decades, a lot of new material coming to the dentistry. Before we may use gold or different metals to do with the fake tooth, but zirconia now is very popular in dentistry. Zirconia says announced they can do 100% biocompatible, and also it's the color is very similar to real teeth, and a lot of advantages for the patients and dentists. But zirconia is very hard. It's very difficult to repair or to modify. So the handpiece, the power of handpieces is quite important nowadays for the dentist to use powerful handpieces to deal with the zirconia. That's one of the reasons. And also the electric handpieces is much quieter. The air-driven handpieces is around 70 to 80 dB when they do the running, do the operation. And electric handpieces is around 50 to 60 dB, even lower. And for the electric handpieces, it's really convenient that you can read out all the information from the control box. We call it control box. And as you know, for the air-driven handpieces, you can only do running. If you put the pedal, put it on, it means running. And if you don't want it, you release the pedal, that means stop. So for air-driven handpieces, dentists have only two options, running or stop. But for the electric handpieces, actually you can read and control the RPM or torque by control box. So that means you can put the handpiece, keep running, but maybe this part you need 300,000 RPM, and that part you need 100,000 RPM. You just need to put down the control box. You can adjust the RPM and torque. And In this slide, you can see that we have the green part means different operations in dentistry. So from the left up side, it's root canal treatment. Maybe we need RPM from 300 RPM to 600 RPM. And from very right and downside, it's crown and cavity preparation. Maybe we need 100,000 RPM to 200,000 RPM. So we have eight different operations in dentistry here. We can just use one control box and one handpieces to finish from the root canal treatment to polishing, to finishing, to remove the crowns, to remove the fillings, or to do the prophylactics and to cavity preparation. All the treatment, you need only one handpieces and one control box. So it's also one other advantage for the digital handpieces. So now I'm for electric handpieces, it's not very easy to manufacture. There are around 6 main manufacturers of the worldwide for the electric handpiece. As you may know, the Bin Air Switzerland, the NSK Japan, and W&H Austria, and Sirona in Germany, and Cable in Germany, and also Codent. Here we are in Taiwan. And for the, of course, for the handpiece itself, the digitalize is a long way to go. And but we can see some future of dental handpiece already. First of all, the electric handpieces will be required for all the dentists, and digital control box is also required. And so the digital electric handpiece will be the standard equipment for all the dental units. That means if you want to open a new dental clinic, you buy the dental chair or dental unit, it must, the digital electric handpiece and control box has to be built in. And the fourth, the high-speed handpieces will be phased out gradually. And we see this trend already in European countries already. And the last, digital control box will be the carrier for the data, before, during, and after the treatment. As you may know now, for the dentistry, it's very difficult. It's not like the operation in other different medical specialties. In dental, it's very difficult to record or to carry the data during the treatment. But now the digital control box will be the role to carry all the data before, during, and after the treatment. So that means if all the dentists to change from the air-driven handpieces to electric handpieces, the digital is not the digital for dentistry is not only for the implant technologies, also will be for the different not only for the implants but also for all the treatments. Okay, here is example that from Europe, maybe it's very interesting. I'm going to share with you. This is the unit also from one of our customers, Castellini in Italy. You may remember that the first photo I'm sharing with you, the Castellini export to Asia, the unit only one electric handpieces. This blue unit is they are selling inside of Europe, and if you enlarge this part, you can see very interesting. This unit equipped two electric handpieces, so only one air-driven handpieces. That means in Europe, it's actually the standard model they are selling in Europe. So that means the electric handpiece is not so, it's very popular in Europe, and the air-driven handpieces not used so much. So as I talked to the customer in Europe, that they said the young dentists they have no training. They during their school, dental school, they don't really learn how to use air-driven handpieces. They are training all by only electric handpieces. That means the young dentists coming from the school to the market, they know only about the electric handpieces, not anymore any air-driven handpieces. So that's the information for your reference. Okay. So that's the digital trend of dental handpieces I'm going to sharing with you today. Thank you. We can take some questions.
Yeah, I can say some. If you want to have a question, you can type in your chat box so I can read to the speaker. Okay, thank you, Ching, for your great introduction about the handpiece. Okay. Let me start first. Okay. So, Ching, right now you only focus on the speed of the handpiece, how much RPM, so and also the digital control box. Current technology, is it able to quantify how much? For example, you're going to drill a hole. How deep the hole being driven can be direct read from your handpiece. Is that technology available now?
Yes, it is available now, and it's not for restoration. It's for canal treatment. It's available, but it's very because when you do the canal treatment, it's very deep. So it's some special equipment can measure the how deep the dentist has to use. But not for the all handpieces. No, not yet.
This feature is important, or maybe it's a must have, or it's better to have for the dentist.
Yes. I think it's also very difficult because some holes is not straight. It's the holes is the cavity is not straight in the teeth. So sometimes it's a big hole downstairs, but the small hole upstairs. So it's quite difficult for dentists and the equipment itself. Yes.
Okay. Any speaker or audience have a question? Maybe just a follow-on question. I know everyone go to the dentist. The most afraid part is the noise. Okay. So I know every company try to improve the noise through the motor skill or the reduce the vibration. So is there other way to improve the burr, change the burr, the material or the hardness or some mechanical property to reduce the noise? Because the noise comes from the handpiece itself, also during the drilling between the burr and your denture. So is there any other way to reduce the noise through improve the material property of the burr?
The material of the burr can be improved. I agree with you, and but it's very limited to go down the noise, because one part we cannot change is because of the teeth is very hard as well. So the two hard things when they do something together, it will be a lot of noises. But one very interesting project I study in Ching University biodesign classes, our team made actually like the ear something to change to block the noise from the patient. It's not to improve the device itself, but try to play some music for the patient to release his nervous, something like this. It's very interesting.
Okay, thank you. Okay, any question from the audience? So if no further question, let's thank you, Dr. Yiqing Fang's great speech. Okay, thank you.
Thank you, everyone.
Yeah. 这边还没看到。Sorry, we have a question, emerging question. Okay, I'm curious about mention how now young dentists only know how to use the electrical handpiece. Then how the outcome combine the technique of the AI, is it possible? Because you mentioned the young dentists only know how to use electrical handpiece. So do you have a comment about how about combine this technique since it is electrical? Can it combine with the AI, and is it possible?
Okay, and it's a very good question. Thank you. And actually, half of the world still using the air-driven handpieces. So that means a lot of data didn't digitalize. And in Europe, they changed to electric handpiece with the control boxes for quite a long time, maybe for the 10 years already. So they basically collect some data. And as I know, there are some people also in Taiwan, they are trying to make inventation of the robots, dental robots. So that means the robot has to know a lot of data to replace the hand of a dentist. So that will be, I think that will become true one day. And some people are still doing this already.
Okay, thank you, Yi-Ching. Okay, due to time limit, also we're going to move to the next talk. Okay, thank you, Yi-Ching. Okay, okay. Okay, if other further question, Yi-Ching, can you just check the checkbox and answer with your text? Okay, thank you. Okay, next move to the next speak. Okay, next speak is from Thailand, also a long-term friend, from Dr. Pranai Nakaparksin. Dr. Pranai is the Doctor of Dentistry. Is from Department of the Advanced General Dentistry at the Mahidol University, Faculty of Dentistry. Okay, today Dr. Pranai going to present as the digital era of implant dentistry. So welcome, Dr. Pranai.
Hi, thank you, Dr. Ye, for your introduction, and thank you for having me today. And very nice presentation, Dr. Fang.
Okay, thank you, Dr. Pranai's wonderful talk, and we learned that and also she's amazing advancement in the digital implant in the Mahidol University. And we have two questions from the audience. Basically, all the relate to the virtual reality. So during the implant, so is it possible to integrate with mixed with reality glass like a HoloLens? And during when you do the implant and use the hollow glass, those used for the virtual reality to monitor the dynamic, also the dynamic guide, make them more accurate. Okay, do you have any comment about this issue? The other issue also related to the AR and the VR. I think it's a similar question. Okay.
Yes, that is a very good question. I actually know that some of the company, I cannot remember the company name, they are actually developing a merge between the actual patients, and then when you put glasses on, it shows you where the actual bone structure of the patient located. And that helps you in terms of placing implant as well. They are actually working on it, but they're not out there on the market right now. So if you're interested, we're also welcome to do research on it.
Okay, thank you. I have one personal question. Okay, so I know the price or cost is will influence the popularity of this technology. So from traditional to the right now digital. So what's the cost change, and next who pay the price because in Taiwan we need to pay by patient and sale, but how about in Thailand? And also one technical question. You know, surgical guide is basically at the beginning is for the inexperienced dentist, but if the patient need the surgical guide in your hospital, who make or who design or the surgical guide? By the doctor or by the technician from the hospital or by technician from the vendor?
Okay, that's very, very good questions. For the payments here in Thailand, patients pay out of their pocket, so all the costs will go to the patient. Yes. Now, in terms of cost for creating the surgical guide, here at the schools, the cost is not that much. Probably 50 to 70 US dollar. Not that expensive, to be honest. Now,
Yes,
in terms of designing, there are two ways that we actually do here in Mahidol University. One is the dentist is the one that create and design everything from beginning to the end. Another one is we ask the technician to actually put everything together first, and then the dentist have to be the one that fine-tune and verified it.
It's if a dentist do it from the beginning, I think only cost $15 to $70. It's really cheap. Yeah, I think in Taiwan maybe it costs around maybe 20,000 NT dollar. It's around the 20,000 Thai dollar. Okay, so that's why it's not so popularity. Especially surgical guide usually is used for the inexperienced dentist. Right?
Mm-hmm.
Yeah, if you like
Understand.
experienced dentist like you, probably you don't need to use surgical guide. Okay, because due to the time limit.
That's
okay,
true.
sorry. Thank you.
Yes, go ahead.
Because due to the time limit, we need to move on to the next speaker. Okay, let's. Thank you, Dr. Pranai. Wonderful talk. Thank you. Okay.
Thank you. Thank you very much for having me.
Thank you. Okay, next move to the next speaker, our long-term friend, Dr. Hoang, I just mentioned earlier. So Dr. Hoang is from the Ho Chi Minh, the University of Medical and Pharmacy at the Ho Chi Minh City. Today, Dr. Hoang going to present as integrating digital technology into the dental education. Okay, let's welcome Dr. Hoang.
Yes, good afternoon, everyone. Yes, thank you, Professor Minh Long, for your kind introduction. And again, it's my pleasure to join this webinar series on smart healthcare science and technology. The theme of today is digital dentistry. So it's my honor. It's also my pleasure to in this today because I see again one of my best friends from Mahidol University, from National Ching University. It's quite a long time to see together due to the COVID-19. So I'm on the college and friends. Today is also my honor to be in this webinar and to let you know some one topics regarding our real situation at our faculty of Odonto-Stomatology, University of Medicine and Pharmacy at Ho Chi Minh City. And my topic today is integrating digital technology into dental education. But I think I used it to raise this topic some months ago. So I would like to continue to share this topics because we want to integrate digital technology into dental education, but how can we do? So the objectives of this topic in the afternoon, I would like to share with one of my respected colleagues and friends over the world in Taiwan, in Mahidol University, in Thailand, especially from Mahidol University and National Ching University, our experience from international collaboration in COVID-19 pandemic regarding to promote digital technology into our current curriculum. So I'm home. I still keep like the vice dean for the faculty of Odonto-Stomatology, University of Medicine and Pharmacy at Ho Chi Minh Cities. I think all of my colleagues here in the afternoon from Thailand, from Taiwan, know quite my university and also my faculty very well. So to be started, I would like to study the book I mentioned you before, the dental education at the crossroads, challenge and change. It published in the early of year 2000 by Institute of Medicine. In that time, of dental education in United States at the crossroads. But now, during 5 years, recent 5 years, the dental education in Vietnam also at the crossroads. And why I say that, the figures show you in year 2016, one dentist in Vietnam served more than 50,000 population. But our last survey in year 2016, we have no new data until now. In Vietnam, one dentist just served around 22,000. It's still high, but in Ho Chi Minh City, in my city where we are living, one dentist served around 14 population. So look at the figure. You can raise a question to me why the number of dentists in Vietnam increases so much after 10 years. So the next figure show you that maybe the dental school in Vietnam. The question is the number of dental school in Vietnam increasing so much during last 10 years. In the early of 1990, in Vietnam, just only have 2 dental schools, one in Hanoi, one Ho Chi Minh City. Now we have more than 17 dental schools over Vietnam. And now we have many private dental schools. Some of them just have been established to serve the high need of the dentist in our population. So the private school and public dental school is developing so much in Vietnam. And every year we had more than 1,000 fresh dental students to study the Odonto-Stomatology program every new academic year. In here we call the Odonto-Stomatology and you call the Dentistry program. That's what the number of every dental school, they had a mission to train the new new dentists to serve for our population. And you look at the two trees I show you in this figure. I think some of you know the tree very well before. They had a problem tree of oral health in Vietnam. We also developed a solution trees of oral health in Vietnam. Of course, we training the new dentists, we training the new doctor of Odonto-Stomatology to solving the oral health problem in Vietnam, based on the two trees. So, but in year 2060, our Ministry of Health, they launched maybe the core professional competency of a doctor in Odonto-Stomatology. It means the new graduated doctor, graduated from any dental school over Vietnam, had to obtain at least the core competency based on our basic requirement from our Ministry of Health, and the core competency, it look like the same any competence, any domain, any basic domain for any dentist who graduated from any dental school over Asian country and over the world. So in here you can see it to be dentist, they need the knowledge, they need the psychomotor, as it means skill, they need the bad heart. So in our Vietnam the dental professional competencies also had a 6 domain regarding the critical thinking and the knowledge, the attitudes and skill. So the totally in the competency we had 76 major competencies regarding this decision. So the question is, the current curriculum is still adapted with the new with the core competency based on from our Ministry of Health. On the old curriculum, it also adapted with the high needs from the new generation of dental students. I mean that the generation yes dental students who were born after year 2000. So that's why we decided to revise our current curriculum from the type-based curriculum to competency-based curriculum. And here you can see the blueprint of our new competency-based curriculum. So to adapt it with the new generation of dentists and to adapt it with our Ministry of Health Vietnam Dental Professional Core Competencies for newly accredited doctor of Odonto-Stomatology. So when we teach the new generation of students, two questions I would like to ask you. We teach them what do our students need to learn, or what do we want to teach students about our respective area of specialization. It means I am the specialty of the community dentistry. I just want to teach the community dentistry, and I want to raise on my best knowledge regarding community dentistry and to transfer the knowledge to our students. Have we ever asked what do our students need to learn? So it for the philosophy of dental of education, you start on a top-down concept or you based on bottom-up concept. So I just mentioned you before, we are teaching the new generation of dental students and within the new digital technology. So for the new generation of dental students, and maybe they belong to the generation yes, and the digital technology is a part of their life. They're using smartphone, they're using tablets, they're using laptop on daily basis since they are a child. So they expect everything to be fast, instantly, and available 24/7. So how can we deal with this? How can we teach the new generation of dental students? And we also know the digital dentistry has been slowly furnishing dental practice and dental institutions on the crown of our global. The new generation, I mean the generation yet is the native resident of digital technology. And our dental school and our faculty need to be deferred for this transition in the dental practice for the new generation. So here you are, based on this, the core competency for the newly graduated doctor of Odonto-Stomatology in our faculties. We revise our current curriculum, and the philosophy of our new curriculum come from the science of biomedicine to comprehensive oral care with the patient-centered care approach. So when we say the comprehensive oral care, we need to apply from the diagnosis to the comprehensive treatment planning. And of course, we want to offer the best treatment for our patient. But the best treatment regarding dental treatment, if we do to apply a more technology into our treatment procedure. So I would like to bring you back the very much, I think, quite very famous framework from Frecko in his textbook regarding digital dentistry, a comprehensive reference and review for the future. And this figure is show you the digital dentistry more horizon. And you can see the digital data sets, and you can see that maybe there's something regarding the whole thing regarding digital dentistry. But my question is how to bring the figure into our new curriculum. Of course, if you want to teach the digital dentistry in dental school, you need the human resources. I mean, you need maybe the key staff who can very effort, who are very fluency in digital dentistry, who will be learn digital workflow, and who are also can have more appearances, not only in the traditional dental practice methods, it also the digital technologies. Of course, we, the dental school, we need to recruit, we need to well training the new faculty member to take on the roles in digital dentistry utilization and in structure. It is very, very important issue. Without human resources, without the key staff in the digital dentistry, I think we cannot integrate anything regarding digital dentistry inside our curriculum for the dentist, or we call it for a doctor of odonto-stomatology. So we could say, everyone is say, you can only teach what you are able to perform yourself. How can we are able to perform ourselves? Or how can we do the able perform for our key staff to teach the digital dentistry in the new era of the digital technology, to teach for the new generation of dental students nowadays. So here is some of the issue everyone says about the challenges in adapting the digital dentistry in dental education. The first is challenge in human resources. I just mentioned you before. The second one is the curriculum revision or the curriculum revise. We have the new and modern curriculum and integrated the digital dentistry look like one of the key module in this new curriculum. And the third one is the digital infrastructure. Of course, we need more investment about the infrastructure, hardware, software, devices to support us to teach the digital dentistry. So it is three big challenges if we want to adapt the digital dentistry in our dental education. The strategies for us, we are the one of the dental school over Vietnam. I think one of the oldest, the dental and biggest dental school over Vietnam. But to be adapted with the digital dentistry inside our current curriculum is very challenging. But we need to step by step to set up and to integrate the digital dentistry in our current curriculum. Our strategy is that how to match our staff, our young staff who have the knowledge about digital dentistry, get the international training. And the second one, we need to cucumber to need the potential generation of dental students who want to learn the digital dentistry and who will be maybe the potential staff in digital dentistry for our faculty in future. Before we start to develop the module of digital dentistry in our new dental curriculum. So the start is from because in Vietnam we have no efforts regarding digital dentistry and the professor how no more young staff to learn the digital dentistry approach. So our strategy to have the international collaboration and to have the international support from our college, our friends, and our partner around the world. But this international collaboration will be happened for many years ago. But last 2 years until now, the situation of COVID-19 pandemic and the social distances, it's not easy to send any staff to go abroad to study the digital dentistry. It's very difficult to invite any professor at first outside to Vietnam to training the digital dentistry for our staff. So the big question, how can we do? How can we promote the international collaboration during the COVID-19 pandemic no matter the social distancing? And we keep to tell the trend, the key stuff to be the quite the basis of effort in digital dentistry. So you know that during the COVID-19 pandemic, like we are today, we had a meeting, but together, but the webinar, the visual meeting, we see together, we just look at our eyes and look at something in a computer. We work online, we study online, we meeting online, anything online. So how can we perform international education cooperation in the COVID-19 situation, COVID-19 pandemic, and how we work online to promote the international collaboration? So in here, in the early of this year, we have set a very special digital dentistry course in cooperation between our faculty and the School of Dentistry, National Yang Minh Cheng Universities. With the support from the Professor Alan Minh Lung Chu, the Dean of the School of Dentistry, National Yang Minh Universities, and with the support from the key staff regarding digital dentistry, we established the core of digital dentistry course. And of course, more also the social distancing. Most of our key staff also had maybe the special training, the special call to join the first call digital dentistry organized by National Yang Minh University. And we established the digital dentistry call for dental students. I would like to share you how we run the international collaboration called digital dentistry course. Of course, the same digital course happened in National Yang Minh University. Also, the same course happened in our faculty. So, to be started this, of course, regarding the course, according to this topic, it's like the first model. So, at National Yang Minh University, we just recruit 12 outstanding students from the National Yang Minh University, and also the 12 outstanding students from our faculty. It's very challenging because we had at least 100 dental students, and we just recruit only 12. So it means our students had to pass the three exams. The first is entrance test by online. The same test happened in the National Yang Minh University with the 30 MCQs and writing, and the writing test. And we had the online, the on team is just on the test, the entrance test by online, and on is also the online evaluation. So in here you can see the third round. The first round we had the first round qualified reach. We had many dental students. But the second round for the writing test is just only the 15 candidates qualified for second round, and they had the attend the interview online, the face-to-face interview, and after interviewing with the board of my dean, the key staff to get interview and to make sure that the student is very have the inner skillful to join the digital dentistry. And finally, we had the finalists with the only 12 excellencies dental students who can speak English, who can learn anything, who are very excellency in their performance test. And these 12 students is the first dental student in Vietnam to study digital dentistry course, with the 12 dental students from the National Yang Minh University to join. And here the way we select the best student, it is very important because I mentioned you before, they are the potential generation of digital dentistry, and we need to take care of them right now. until after 2 years, I think we had a group of the digital dentistry course, digital dentistry member, and they will back to give a hand with their mentor to develop the new model of digital dentistry. So we also by this one, we also did by joining digital dentistry course, we also had maybe the key mentors who can run the digital dentistry course in outside. So here you can see the digital dentistry module, the established, developed by the key group from the National Yang Minh University, and also the key mentor from our faculty. And here you can see maybe the content of the digital dentistry module. And of course, when we teach the digital dentistry model, we had two parts, the theories and the practicum. The theories is set in online. My student studies, my excellency students, they study with the dental student from in National Yang Minh universities. And for practicum, we had to organize independently because these two universities is located in two places, in social distancing and COVID-19. But I think you can raise a question to your in your mind that how we organize the practicum with the same cost, the same skillful between two universities. And here you can see I've shown you some of the photo of the digital dentistry module activity in outside. In here, we had maybe some of the lecture on site. From the practicum, we organize only practice inside our university. And the same issue happened in the National Yang Minh universities. And you can see some photo here, our students to practice to use a scanner, intraoral scanner, but not only one brand of intra scanner. We use the 3-step, we use the primer scan, we use the iMedis, and we use many kind of oral scan is available in our Vietnam market. And we also use the design software. We use a 3D printer, and the most on thing, the basic thing regarding digital dentistry and machine and everything, our students can practice at our faculty. And beside that one, our key staff, the young staff, with the potential students, we organize some crowd table on digital dentistry for students in annual scientific meeting and technology at our faculty in the last month. And we raised some the crowd table, and our crowd table attracts many participants, many dentists outside to join, because it is a new concept. It's just online the basic of to use intraoral scanner, basic of about how to evaluate the trace by using electronic devices. And the crowd table, it looked like the first challenges, not only for our young staff, our young faculties, but also for our students to learn more about how to transfer something they learned from digital dentistry from National Yang Minh University and transfer this to our local dentists. Also, the key staff, the teaching, the trainer, not only from our faculty, we also invite some of the efforts from outside of our university in Ho Chi Minh City to be the lecturer from the course. Like in this photo, you can see the very famous digital technician in our city. She had a 2-day training for our students how to do something regarding the stand, glaze, 3D printer and something like that. Some issue our staff cannot familiar with. So you be the person to give a hand to train. And during 2 days at the famous digital dental laboratories, our students learn a lot of issue regarding the digital workload and how to apply it in the daily practice. Of course, when students learn, we also make them some feedback about the course. And here you can see students report in the social media after each class with the hashtag. It look like a fun face, and you can see that something they comment and something that they learn. And the topic, the feedback we want our students to say what do they study today, and what made them motivated in class, what do they misunderstand, and what is the most impressive moment in the class when they study. So here you can see some comment from our student like us. They said that for the first time, I know how to construct a 3D image and intraoral scanning. That's amazing. The atmosphere in the class is always fun and making delighted, and I like the joke of my friends and mentors. Although it's busy days, I still feel excited to forward on about being tired and hungry when I come to a DDM class, because it is the first time taking a digital dentistry class, which is my favorite thing to do with friends from the Minh University and thousands of miles away. I always strain my nerves to listen what the lecturer and mentor say in the class. I do not understand many words, but I can get their meaning a little bit. The first experience was very enjoyable. I need to refer more carefully for next time. Well, the scanner cost is 2 or 3 billion of them, and 100 million annual maintenance monies. And do you like the touch or the piano sound of the intraoral scanner? Thank you, DDM friend and mentor of your to assist help. So here is a statement from our student. The reason I show you this statement because the DDM call happen after 5 p.m. It means in the end of the days, the student is still study hard from 7:30 a.m. until the 5 p.m. And after 5 p.m. they come to the class with a very enjoyable and funny. So that I say we teach something our students want to learn. So here you can see any class also the treatment, what they learn, what they taught. The student also evaluated after class online. This survey, the assessment is very, very important for us who run this course, because it allows the experience we can use it in the future when we develop the officially module of digital identity in our new curriculum. So the same time happened in Vietnam. The 12 group, the 12 dental students from National Giang Minh University, they will study the same, they will practice the same model we are. They use scanner, rhymer, and they use scanner, design, CAD, CAM, 3D printer, and something like that. So some photo I show you here is some activity happen in the National Giang Minh University with the group mentor, the group lecturer from these universities. So here you can see some of the activity inside the digital identity module at the National Giang Minh University. The students do a lot of activity. They get some the observation of the mentor using devices, and they practice by themselves. They do more discussion with the mentor, and also they discuss together. They do more discussion together, not only inside the group of Taiwanese dental student, but also the Vietnamese dental student. They do the more discussion online together and to find out something they need to learn. So here you can see the final product, not from both sides, from our faculty student, Vietnamese student and Taiwanese student who joined the same course, the digital dentistry module during the COVID-19. It just maybe some virtual online, then practice on site. So this I just sharing with you. The second issue in my presentation is the appearances regarding the international collaboration during the COVID-19 between our faculty of Odonto-Stomatology, University of Medicine and Pharmacy at Ho Chi Minh City, and the School of Dentistry, National Yang Minh Universities. So based on this training, now we had a small group, the key staff, regarding this to learn more, to know more about digital dentistry. We also the 12 of dental students to start to study the basics of digital dentistry, and we are very confident to start the workshop, the digital dentistry days in our faculty of Odonto-Stomatology. The conference we call a hybrid conference, planning to happen in the middle of this in the middle of October in this year, in 2020, in cooperation between our faculty and Trong Research Center. I mean the center, University of Medicine and Pharmacy at Ho Chi Minh City and the National Ching University. And here you can see the three prints. This print we have designed from our mentor and our dental student after studying the 3D design. So if possible, I would like to invite from at first our professor college and professor from the National Yang Minh University, the School of Odonto-Stomatology, to join our digital dentistry day and like the speaker and last speaker or presenter to send our knowledge and the experience in digital dentistry, not only for our faculty staff, for our dental students, but also on the dentist over Vietnam in the middle of this October. So to be close my presentation, I would like to back the very famous statement from Albert Einstein, and I think you know very well we are in the normal trend after the COVID, because due to the COVID-19 pandemic, and we are in the new normal trend, the new trend in the modern dentistry, in the modern dental education. Of course, we cannot use an old method to apply the new normal trend in dental education. So by the Ambassador treatment, I would like to close my presentation. And if you had here, also had my email address. If you have any question, if you have any concern, and if you guess you think you need to do some cooperation with our faculty in digital dentistry, please feel free email to me. Once again, thank you very much for your attention.
Okay, thank you, Dr. Hoang's wonderful presentation, and also you put so much effort to explore, to adapt the digital dentistry into your current dentistry education. Because due to time limit, I only ask one question from our student. So because digital dentistry is also depend on lot heavily on the skill of like a programming software. So I was just wondering, for your curriculum, do you teach those students how to do the programming or do the learn the software by themselves, or they need to learn by you taught by your course, or students need to learn by themselves? If going in the future, the dentist is going to work on their own research or develop a new digital dentistry, they need those kind of skill. So we're just curious, do you put those curriculum into your new digital dentistry curriculum. The students' programming skill.
Yeah. Thank you, Professor Minh Long, and thank you very much for the question. I think it's very intriguing question. This question is also very intriguing because when we as I mentioned in my presentation, when we start to teach the digital dentistry, it's very challenging because we have to consider three things. The first is the human resources. We need the effort. We need the professor who are very fluency in digital dentistry. We had a big knowledge to transfer the knowledge and fluency and skillful to dental students. The second one is I mean that in the infrastructure is very important. We want to teach the digital dentistry, of course, we need many devices and of course like the intraoral scanner and software regarding this oral scanner and CAD/CAM machine and 3D printer machine and software. The software is very important, but how can we have it? Of course, until now, our university had no more the digital device inside our hands. But that one I say the international cooperation, and the cooperation is very important. In the already course, we for the theories, the knowledge transfer from the National Yang University, from the software and devices, we borrow from our commercial partner, like the Trisha company, like the Dentsply Serona company, like the Sri Rats, like the iMedic from Korea. Most of our commercial partner in Vietnam who are selling, who are promoting the digital devices, we would like to invite them to join the course. And they play the role like the main sponsor for this to sponsor for our devices, for student devices, material for students to learn during the course. Of course, for a long time, we cannot do the same way we are. We need to do more investments. And our faculty are step by step to invest the device and the other issue regarding digital dentistry before we start to launch the digital dentistry module course in our new curriculum. Of course, because the software is very advanced, so but now we are in the beginning the era of the digital dentistry. So most of software, most of everything very advanced. But trust me, to be honest, I think in the next few years, some of the digital device is not so advanced like the price right now. So I think not only the dental student, but also the dental practitioner over Vietnam or in the developing country like Vietnam, we can approach the new digital technologies. But the important, the device and software and anything is not anything with this. The important we need to spend our time to study. We need the learning curve about digital dentistry first, and the device will become later. Thank you very much.
Thank you, Dr. Hoang, and sorry because you already been over the time limit, so we're going to close this talk. And because currently your school is collaborates with Yang University, and I think if NCK have much stronger engineering and IT college, maybe in the future we can work together with School of Dentistry at NCK to offer similar module course, and we can have further cooperation. Thank you, Dr. Hoang, again.
Yeah, thank you, Mr. Minh Long. I also hope maybe in the future.
In October we can go
together.
Yeah.
So
okay. Thank you, Dr. Hoang. Okay. The last but not least, talk today is from our faculty member from School of Dentistry, Dr. Chong. He's a Doctor of Dentistry and also the Ph.D. From the University of Minnesota. And Dr. Chen is also long-term working on the digital dentistry. So today, he's going to present us the application of digital workflow in removable prosthodontic. Let's welcome Dr. Chong.
Okay, so can everyone see my presentation?
And I also can hear you well. Okay, Dr. Chen, please start. Okay, thank you, Dr. Chen, for your wonderful presentation about the digital workflow in the how to produce removable prosthodontic. And now we have 3 questions. I think we need to move very quick. First is a very common question. What about accuracy? 3D printing compared to a CNC technique. Which one do you think is more accurate?
Well, actually, in my experience, the 3D printed one is actually better than the CNC technique. The main reason is with the 3D printing technique, I can get the very detailed design, for example, like a clasp. But with the CNC technology, sometimes I lost some details on the, for example, the tip of the clasp.
Okay, next one is, sorry. When you design during the CAD design, so whether the model structure was designed by you yourself, or this can be done automatically by the software, especially like a basal part about the denture.
Okay. Yeah, actually some of them, the software has the capability to generate the design for you. For example, they are actually the software has embedded some AI features, so they can predict the contour first, and I mean give you a contour first, and then but you still have to modify a little bit. So basically, I always communicate with my technicians. So my technicians will give me the digital design, and I will tell him that which part I would like to modify a bit, and then he will help me to modify the design. And then once both of us we agree the design, then we print it out.
Okay, I think we have more questions, but due to time, I just only ask one final question. Okay, during the design, especially like CAD design, so should we consider the mechanical property and the stress distribution during when you making the model compared to the actual teeth? Because the mechanical property for the material, either you use CNC or use 3D printing, the mechanical property should be different. When you design, then you can also consider those differences. Yeah.
Well, I think this is the one thing we should look forward to, because the one thing actually is still missing in the dentistry is the stress analysis. Well, since we can get this digital model already easy, then I think the next thing we have to consider is we might have to have a mechanical analysis modules in our designing software to help the dentist to understand his or her design. This one can be like long-term durable. Yeah.
Thank you,
Okay.
Dr. Chen, again, because we're over 55 minutes over time. Okay, so thanks again, and thank you today's four wonderful presenter. And because during the COVID-19 pandemic, so we can only the certified appreciation will send you through the mail. Thank you again. Okay. Thank you again, all our distinguished guests and a wonderful presenter today. And we really appreciate it. And especially those guests from the Vietnam and the Thailand. And we need to close today's webinar. And thanks again for all your participation and spend the whole afternoon with us. So our next webinar will be held on June 24th. And we're looking forward to see you again next time on June 24th. Thanks again for all your presentation. Thank you.